Thank you, everybody in the Hindi session. Good morning, good afternoon, good evening. Welcome to the 1775th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's process with a silent prayer for a minute.
Dr. Manoj, I have made you the host now.
Yes, sir. Yes. Thank you, sir. Thank you and welcome back. Today we have with us Dr. Professor DHWANIKA Ji DHAGAT, MD Homeopathy, Professor and Head of Department of the Postgraduate Department of Repertory, PG Coordinator in Sri Swami Narayan Homeopathy College, Homeopathy Consultant Dhoni Homeo Clinic near Manindakar Crossing, Ahmedabad, clinical experience 19 years, academic experience 16 years, ex-principal of Monarch Homeopathy Medical College. And today's topic is very interesting one as well as an important one because we all know the relevance of the repertory, NEER'S repertory. So the topic is clinical application of NEER'S repertory. So on my behalf of IFPH, I welcome Dr. DHWANIKA, please. I think she's not able to join. Dr. DHWANIKA, are you there? Please raise your hand. You could not. Yes, Dr. DHWANIKA, you can start. I already completed the proceedings. It is 8:32 now. Yes, please, Dr. DHWANIKA, welcome. You are muted. Please unmute. Yes, please.
So, thank you, sir. I am being privileged to call again. That is, this is the third time that coming I am here. I am thankful to Dr. Sahani sir and all the associated members with IFPH and this noble cause they are carrying for promoting this homeopathy, and especially in the young homeopaths. These young homeopaths, through these webinars, they are able to gain a lot of knowledge. I have seen many of the seminars, many of these meetings in which special clinical meetings where more of them are clinical meetings. So this has helped in a way for these young homeopaths to get wide knowledge. So now I'll start with my topic, that is clinical utility of NEER repertory. Usually this is a lesser known topic because majority of the people think that NEER repertory is just for the reference purpose. Yes, that is a fact that NEER repertory is for reference purpose. Repertorization can't be done through NEER repertory, but it is a key to those cases which are not which are difficult cases which cannot be solved easily. At certain point in the clinical practice, you need this reference, and main thing of this NEER repertory is this repertory is based on the pathological symptoms and the clinical symptoms. So more of the clinical symptoms are covered in it. So I'm sharing my PowerPoint. NEER repertory is majorly based on the herring-adding symptoms. It is based on the materia medica symptoms of herring. So he has compiled, Dr. Nair has painstakingly taken the 5 years to compile all these symptoms, and that symptoms were finally compiled in a book, and he came with the repertory. And it was in 1896. Unfortunately, many of the homeopaths were not aware of this because it was not widespread. The main reason of the lesser known main reason that NEER repertory was not known much was its construction. If you see the NEER repertory today also, the original NEER repertory, if you see, you will not be able to find the rubrics very easily because there is much lesser space after each rubric, where the rubric ends and where there is the markings that you can't differentiate it. But now in the Shiv Raman edition, they have very nicely incorporated all the rubrics and you can differentiate it. So if you go with the old this edition, it is very difficult to use the NEER repertory. But when you use NEER repertory, you come to certain golden rubrics which we have used in the practice, that I'll tell all the cases in the later on my PowerPoint. There are a number of the cases through which in which I have used this NEER repertory. Now, basic of the NEER repertory. Generally, as in the guiding symptoms, so in the repertory, the original readings and the words of the provers and the clinicians were preserved in this repertory. And that's why it is a concordance repertory. Majorly, the delicate shades, that the meaning of these rubrics are not changed. Occasionally, the words, the similar words has been taken, but that has been taken in the extra cross reference or cross rubrics. So in this repertory, the grand generalization is not done, and individuality of the cases has been maintained. Now the word concordance. Concordance means the state of being at same as heart and the mind. So all the symptoms, all the rubrics has been arranged harmoniously, and the symptoms, it has been arranged in the alphabetical order that has been suggested by Dr. Hahnemann. Similarly, this originally this concordance word that came from Dr. Boningerson, he was the one who has first coined the word, and that was coined in his book, that was Therapeutic Pocket Book. This book belongs to a Puritan group of the repertories. Another Puritan group of repertory is gentry, where the symptoms are given in their original form without much change. The concordance repertory is designed to enable the physician to find quickly and certainly any desired symptoms in materia medica together with the indicated remedies. So this concordance repertory is usually designed in such a way that if you want to see certain symptoms from the materia medica, you can directly get it without any mutilation of that symptoms. So it is as it is, what you find in the materia medica, you will get in the repertory. In other repertories, what happens that in other repertories, the rubric has been mutilated, it has been broken and taken into the repertory. If you see the synthesis repertory and if you read the preface of synthesis repertory, you will come to know that they have just the single symptom has been broken and taken at the different parts. That is, in the head, it is, if the symptom is related to the head, then the half of the symptom has been put in the head portion, half of the symptom is put in the urinary organs. So likewise, the symptom has been broken and kept into the repertory. So the pure form has not been maintained. While in this repertory, the pure rubric form, the pure materia medica symptom has been maintained. Now it is very difficult structure to become familiar with, as I have said before, because it is very voluminous. First thing, the repertory is very voluminous. Another thing, that there are no spaces between the rubrics. After every heading, after every rubric, again the next rubric will come. So there is no space. So while reading also, it is very difficult to recognize where the rubric ends. You can see the old, book. In this old book, it is very difficult to recognize where the symptoms or where the rubric ends. And hence, because of this difficulty, initially in those days, it was not acceptable. This repertory was not acceptable, while the Kent repertory, which came after this repertory, means that was in 1897, but it was accepted widely because of its structure. The structure was very good. Now, as a reference point for comparing the remedies, NEER'S repertory has a long since occupied a niche position in the homeopathy. Now, why this repertory we should use? One important point is why this repertory we should use. See, at a certain point, what happens? I'll give one example of my clinical practice. In that, there was one case I remember regarding oligohydramnios. I have talked, I have said this incidents to many of my students also, that when you see a rubric, this is a rubric that is oligohydramnios in the parturition, pregnancy and parturition chapter is there. So when you see the other repertories, that is Kent repertory or Bonigason or BTPB, I didn't found this rubric anywhere. But usually the female patients who are having the oligohydramnios or polyhydramnios, certain cases comes to you being a female. So in such cases, what to do? At that time, I got this rubric and there was a single remedy, and that was APs. So at this point, I was very satisfied. So after giving this remedy, she had a remarkable improvement. That is, before and after the sonography, she had a remarkable improvement. So this was one incident where I could have the value of this repertory in such cases. Initially, I didn't found this rubric in another repertory, but after that, the similar rubric, whatever were there in the NER repertory were taken in the FATAC repertory also. So majority of the rubrics you will find in FATAC repertory too. Now, NER repertory contains the rubrics you cannot find anywhere else. And because it is usually useful in the cases where pathology dominates and there is a paucity of symptoms. So when you have paucity of symptoms or where there is pathology dominating and where there are less of the mental symptoms or the emotional symptoms, you should use NER repertory, because there are certain chapters will come through those part. Those chapters are they are treasure. They are treasure. Means there are constitution chapters, tissue chapters, then there are location chapters, then there are many chapters, tendency chapters. So these chapters, they are not found in the other repertories. And it has many beautiful rubrics too. I'll not go in the detail with what are the markings and those things. I'll not go in the detail that you all know. Will directly only few things that I wanted to tell was one theta, that is a Greek sign that that are the pathological conditions or the symptoms of the pathological conditions that I just wanted to mention. Another thing is there are certain signs in the repertory that also will not go through that. This repertory is a faithful, yes, this repertory is very faithful reproduction of guiding symptoms. Its contents classified and indexed, but it can no way take the place of the larger work. Majority of the guiding symptoms which are there in the hearing guiding symptoms, they have been incorporated here. But the classical repertories or the repertories which are here in the modern, which are there in the modern eras, like synthesis, Murphy, though it can't take its place, but the clinical symptoms and the pathological symptoms which are there in this repertory, they have been again taken from this old literature only. In a repertory, we have a separation by analysis for the purpose of classification and ready reference. In Materia Medica, combination by synthesis to enable us to study drug effects in their grand unity and relationship. In repertory, we need to do the analysis, and certain classifications are there. But in So this materia medica, we get direct reference in this repertory. Now we'll directly go to the cases. So first case solved with this repertory is, this was a case of a child 1 year, and he was admitted in a pediatric hospital with continuous epileptic seizures. He had high grade fever, and patient was not regaining consciousness due to continuous seizures. See, during that time, this was way back, somewhere around 4 to 5 years. There was this pediatric was in Anand, and he had a patient of epileptic seizures. But he had given all the modern medicines. Finally, he was losing the hope, and at that time, because that pediatric, he was taking lectures in our college, so he thought, let me sort out a opinion of a homeopath. So he took a opinion from us, and while taking that, we went to the hospital and we took hold the case, and that after taking the case was only being narrated by the father mother. We could see the condition of the child, and they were losing the hope. Almost they have given up the hope. Even pediatric had given up the hope. So there was one rubric, and the rubric was in brain. This is NEER repertory, inner head brain, conversions with unconsciousness and symptoms. McFoss was the remedy. So I can recollect that particular incident. McFoss was given, and the patient revived. Uh, he regained the consciousness, and then he was stable. So after that, the routine medicines were routine medicines, and pint and whatever was been given, that was continued. But majorly, McFoss had revived the child. So this was a very wonderful case. Now this is another case. In this case, there are this case, it is of dystocia. This is not of a single person, because many of the people, many of the females with the dystocia coming to me, I frequently give this medicine. So there are a number of cases for dystocia. Usually dystocia is a difficult birth. It is especially when there is a pelvis is small, maternal pelvis is small, or there is a awkward position of a fetus, then the dystocia occurs. So in this modern terminology, if we say that we can cure dystocia, or we have the medicine of dystocia, then they'll ask all the research, and they'll say that you just go through the basic, what are the parameters, what calculation are there. So we can't treat dystocia. But in the old this NER repertory, they have used the terminology dystocia. So dystocia has been used very wisely. They have just specified that if there is a difficult birth, especially if there is a position, awkward position of the fetus, or smallness of a maternal pelvis. Now, or there is a failure in the contraction of the uterus or cervix. So in such cases, we usually give colophylum. So colophylum 30, and this I have given to number of the patients. Usually those patients who are going with antenatal checkup with that of the gynecologist, and at that time, if a gynecologist, if at that time, if the patient gets convinced, or during that time, the gynecologist also, with the help of the homeopathy, with they consult us and they just allow the patient to take this Colophylum 30. So this is there are also a number of such cases. Even in the homeopathic hospitals also, Colophylum 30 has been frequently used in the cases of difficult labor. So this many cases are there. And the rubric I found for this was in NEER repertory, that was in chapter pregnancy, parturition and lactation. There was a rubric, and that rubric was difficult dystocia. You can see the remedies, the two remedies are there. The one is Colophylum and the another is causticum. So Colophylum is a very wonderful drug for dystocia. Similarly, the another rubric is there. In the case, I have mentioned it, case 3. This is generalized for many of the cases because number of cases are there like this. So I have not mentioned the name of the patient or age of the patient. This has been given many times in abnormal position of the uterus, and abnormal position of the uterus, I initially got this rubric from Phatak repertory, but in Phatak repertory there are two remedies, that is Lycopodium and Pulsatilla. But then I went back to the repertory. The original book that rubric Phatak took was from the NEER repertory. So original rubric you can find in NEER repertory. It is for the transverse positions when head is not fixed. It is you usually need to know that when head is not fixed, and it is given frequently in the patients to correct the position. Now this can be in the this can't be in the last month, that is I am talking about almost 9 months. You can find the rubric, and that rubric is in pregnancy, parturition, lactation, abnormal position. Pulsatilla is a single remedy. Lycopodium is given added in the Phatak repertory, but originally only the Pulsatilla is a remedy. I have given this remedy in many of the patients where the position was confirmed after confirming in the USG. Initially in the USG there was transverse position, but after that the position, after giving Pulsatilla, the position has been corrected. So this is a very wonderful drug, and it is an it is a specific drug for transversing the position. This has been clinically proved also. Now again, the another case is of a child named Shivansh Gandhi. He came with a fever. He had a fever with chills, and there was malaise and body pain was there. After the chills, there was urticarial rashes on the body, and patient was unable to take food. He had a fever since yesterday and was given paracetamol. This child, he came, I think, yes, yesterday. So he came in the morning only, and I just taken a picture of the child, and the picture was taken. Yes. So this rubric we get in the fever section, and there was eruptions with chill, chill after, and the remedy was Copaiba. In the morning, around about the patient came about 10 o'clock, and he called me. After that, 5 o'clock around, that this urticarial rashes has been subsiding. So again, I'll show the picture. He has also few blisters also there with that of the urticarial rashes are there. Then this is a next case of facial palsy. In facial palsy, you might be knowing that usually it occurs in the due to the cold exposure to the cold it occurs, and there is a neuralgia, trigeminal neuralgia. So there was a female named Bharti aged 35 years. She was staying in the Vastral, which is one of the areas nearby, and she was suffering from a facial twitching, that is palsy, and she was taking modern medicines since a long back. Her friend used to come for the medicines to me, and that's why she referred her. She was having attack usually daily. Daily she had twitchings, and that was in the morning time. Morning round about she might be having about 9 o'clock or 10 o'clock. That was usually 9 or 10. Or if at all she is not having in the morning, then she might have till the noon time. But usually from morning to noon. But gradually she reduced, sorry, with the medicines, she had taken the medicines, and with that medicines, that daily attack was reduced. And now finally, after the last consultation, she had attack before 3 months. Here, the pathology was considered, and the symptoms like headache. In that, another symptoms I have not taken all the, I have not kept here whole the case, but the main points which on which the prescription has been based, that I have added. So the main characteristic thing was one. She told that she was having a headache along with the twitchings, and that was every time. So considering this and not getting another other all symptoms of emotional or mental symptoms, and as she was suffering since long time, so I thought to see this NER repertory, and in NER repertory I found out Spigelia, and Spigelia 200 infrequent doses were prescribed to her. This is a video of her. She has taken a picture during this attack. You can see this. Okay. Left-sided affection is there. So this was another remarkable result. She was actually, before she was advised to take the steroids also, but as she heard that if she'll be switch on to the steroids, she came to homeopath. So this is the rubric which I got in our repertory, and that is in nerves. I told you about the chapters also, that it is having very beautiful and wonderful chapters which are not there in the other repertories. So one of that chapter is nerves. This nerve chapter, I got neuralgia in nerve chapter, and in that she had one history ailments from. She told that she was a teacher and going in the morning in the for school. So during that time, when there was cold, she picked up this trigeminal neuralgia. She got it, and considering that she got this first attack during the cold taking from, and she was given the remedy. The remedy was Spigelia. Though the 4-mark remedy and the 3-mark, so 4-mark remedy is Mercurius and Chamomilla, But spigelia, by considering the other symptoms, I took the spigelia. And she has improved, in fact. And since 3 months, she is not having any attack. So that was another case. Now, yes. A girl aged 5 years was having wart on the face, and it was since 5 months. There was no itching, and no other complaint was there. Flat part was there on the right side above the right cheek. Now, the picture was, she posted it me initially, but now I was not able to get the picture from the history. So this was also a very good case. The history, only the history I could get was history of recurrent cold and cough. And in that, no other history was there. Father was having just acidity and mother was healthy. No other ailment or none. Even either the history of viral warts or that was also not there. So 5 years each, having what? So the parents were a bit worried, and they came for the treatment. Whether shall we go for the cautery or shall we go for the homeopathy? But instead of doing any cautery or that procedure, they preferred to come to a homeopath. And this what was gone, and that was the rubric which was selected. That was from NEER'S Repertory only. Yes. Upper face, chapter upper face, and warts and a flat warts. Direct rubric I could get because no history, no other history, only considering the pathological condition, I had prescribed it. The API was prescribed, and to my surprise, this API did a wonderful job because see, it just in I can recollect that in the 25 days, in 25 days, it vanished. So that was, I thought the time for the warts to vanish in 25 days, it's wonderful, because in if I am giving in other conditions also, in other warts condition, usually 2-3 months occurs. It takes 2 to 3 months, depending on the complaint of the patient. That is the first thing. But here only in 25 days, she had a remarkable result of warts. Being a girl child, they were worried much, and that's why when they got quickly this result, they were happy. This is the mouth ulcer. This picture was clicked by the patient, sent to me because patient is staying very at a distance place. Online medicine was given. Only no other history was there. Only that she was having an aphtha and she could not take the food. So only that much history she gave it. Nothing much. Again, in such cases, I would resort to this repertory only, because no other symptoms were there. After Merck signatum, here it is thick with yellowish scab was not seen, But usually, whenever there is FA, and if it is such a severe one, that is, you have seen the severity of FA. So in that condition, Merck cyanatum I usually give, and this is the not only in this case, but usually it happens in children's, and if it is the recurrency is there, especially if recurrently it is occurring, then Merck cyanatum is a remedy, which first time I got from this repertory, and after that I am prescribing in other cases also. Another remedy is Merck core also, that is being frequently using. The severity, seeing the severity will consider, and according to the symptom severity in certain cases. In majority of the cases, you need to take the totality of the symptoms. But in certain cases where there is paucity of the symptoms, you get very less symptoms and no mental symptoms are there. At that time, I would use a Patak repertory, NER repertory, Murphy repertory. So these are giving wonderful results, having wonderful rubrics which guide to the best best similimum. Okay. So this is another case of freckles. Usually females in the climacteric ages, they come with the freckles on the face, and to my wonder, I was initially for the freckles, I used to usually in freckles also, they are very less symptoms are there, and uh, as I have read in the another repertories, that is Kent repertory, Bonigason, BBCR repertory. So usually the remedies coming are sepia for the freckles. See here one thing, in their repertory for the freckles, there is sepia remedy is not given, but instead ferrum is given. So one wonderful pathological correlation is usually I see that in the females, climacteric ages, those who are in the climacteric ages and those who are having freckles on the face, in those females, usually you see a low HB. So low HB is there, that will be helpful in the, so ferrum is helpful in low HB also and in freckles also. So this was a wonderful rubric I wanted to mention, because in majority, we don't use, in majority of the cases of freckles, we don't use ferrum. We don't use ferrum, and another remedy is graphite is also, which also we don't use usually, but it is 3 marks remedy. It is carrying 3 marks, so it is very valuable and important remedies for freckles. This is the picture of the patient having freckles. She was having both the sides, even in forehead also. And gradually it vanished. This is okay. Yes. Now this case is of another case. Yes. This case is of endometriosis. Endometriosis is usually the bleeding outside the uterus, and that bleeding is from the veins that are there outside the uterus, and that will cause at times it is along with that of the fibroid also. And usually endometriosis is a cause of infertility, one of the cause of infertility. So this patient, she was having fibroid along with that of endometriosis, and she was given she was given Ustelago. So this Ustelago, it is she was given in 30 potency, and I remember her. She was having the complaints since 1 year, and she had tried number of the remedies also for this to stop the bleeding, because the bleeding was so much. At times it was intermittent also, menorrhagia also. After the period starts, then again she is having prolonged periods. So that was very difficult for her to, even in day-to-day life, it was disturbing her. So for that, now she was almost, she didn't have a child. Now she is almost 48 years, and at that time I just told her to go for the USG, and in USG this was detected, endometriosis was also detected. So after that she was given this remedy, Ustelago. Ustelago, I remember that I have given in many patients Ustelago, and it has a very wonderful result, because in those females where there is bleeding uterus, usually they come to us because they don't want to go for the hysterectomy. So this Ustelago can save the female from this hysterectomy. That is remarkable benefit also of this remedy. And it is a type of a boon for such patients, because after hysterectomy many issues come to the female.
ODI is not this. Okay. Not audible, madam. Not audible.
See, doctor ne, she is telling that I had much bleeding, and doctor ने मुझे uterus remove करने को बोला था. Now it is audible, sir?
No, not.
Not audible. Okay. So I'll narrate it, sir.
Okay, that's good.
Yeah. The same thing she is telling, that she was suffering from, she had a profuse bleeding, protracted bleeding, and that was since 1 year. And when she consulted to gynecologist told her to remove the uterus, but she didn't wanted to go for the surgery, hysterectomy, and that's why she came for homeopathy. And after coming here, she was given this medicine Ustelago 30, and to her wonder that in tentatively 1 month, she was having completely bleeding was completely stopped. That is initially the bleeding she had in the pause, that is she had the frequency was cut down. She was having bleeding since 1 year. This problem was there. Initially the frequency was cut down, and after the 1 month totally she was complaint free. So after the USG also, that thing was seen in the USG also. There was endometrial thickness. That thickness was reduced. From that she came to know that now she is having, now she is free from endometriosis. So the rubric that was taken was from NEER'S Repertory, uterus, tumors, fibroid, interstitial. Though it was of 2 marks only, considering her bleeding, I gave her Ustelago. And Ustelago usually in the lower potencies, if the pathology is involved, initially this case was of a child, and that's why the higher potency was used, and frequent repetitions, because the poor reaction need a recurrent stimulation. That's why there was a frequent repetition. Now this was a case of a renal stone, a male patient aged 32 years, named Nishant Majithia. He was having a renal pain that came after, and he had gone for the lithotripsy twice. Lithotripsy, he had gone twice, and after that he again got this renal stone. So he thought to consult to a homeopath, and while consulting, I had given him the medicine. Yes. Lycopodium was given, and Lycopodium 30. See, you can see in the single mark Berberis also, and Berberis and Lycopodium both for the renal stone. We are using it frequently, and 100 to 150 more than that patients, we had used it with a very remarkable result. Urinary organs, it is in urinary organs, after urination burning and lycopodium that was given. The reports are also there. Nishant Majithia, he was having 7 mm sized calculus in the left upper ureter and causing mild hydronephrosis. He was having mild hydronephrosis. And multiple bilateral renal calculi were there. So he was also, he came from the hospital. Already she was admitted for 2 to 3 days in the hospital. After that, he thought that I don't want to go for the lithotripsy third time. So so he came here. Already his relatives were taking medicines to me, and they just referred him to me.
Excuse me, madam, only 10 minutes remaining.
Yeah.
Only 10 minutes remaining. Okay.
Okay, sir. Okay, sir. So this was the stone that was there. After removal, he just came to show the stone, and we clicked the picture and we sent here. The patient was so much satisfied. After that, now he's not having the complaint of stone. After going for twice for the lithotripsy, after removal the stone, now he is not having any problem. Now, as the sir suggested, we have much lesser time, but I'll just like to tell certain beautiful rubrics also, which are there, and we have used in the clinical practice, and we have got the remarkable results. So one of such is the last case. I have a video of that case also. This is a case of a lady, and this lady is having tumors that is in breast, and for this tumor, yes, tumors, and for that I have given conium. She is a Gujarati lady, and talking in Hindi.
आपको क्या तकलीफ थी? कहाँ पे गांठ थी आपको? कम में। क्या साइज खाली आप हाथ से बता सकते हो कितनी साइज थी? फिर ट्रीटमेंट करने के बाद वो साइज कितनी हो गई? आपको डॉक्टर ने क्या सलाह दी थी?
So this is another case of fibroadenoma and in the breast. There are two such cases. One is totally the whole the adenoma, it dissolved. This is another case. You can see the patient is conveying by herself the size of the tumor, and now to what extent it has been reduced. So for that, conium was a remedy that initially I got from this particular nerve repertory only. So that has played a remarkable role in reducing the size. So I can't forget this. Another certain beautiful rubrics are there. So I just wanted to share that rubrics with you. Yes. Awakening pain in bowels child who is having in those children who is having abdominal pain, maybe due to the types mesenterica. So this is one of the rubric. In that, petroleum is a remedy. Another rubric is that we find is in tissues. Tissues, that is this also I had a case, and there was the patient was suffering from a measles, and that's why the patient was given euphrasia. Okay. So happy patients are there. Thank you. Yes, sir.
Okay, thank you.
Yeah.
It's a nice presentation, definitely. And it once again reiterates the fact that we have plenty of literature, plenty of monumental works, but unfortunately we never pay much attention to these monumental works. We all know the analytical repertory of mind. It's also an important work. Then another one is by the Calviner, Life of Herring. So I think almost all students of homeopathy must at least once read this or go through this book. It's time for discussion. Only 5 minutes remaining. Anybody like to talk or ask some questions? Please raise your hand. As you rightly mentioned about this a Puritan type of repertory, and of course, this should be more utilized because, as you mentioned, it will not mutilate the symptoms. That's most important. By transforming symptoms into rubric, what happens is that it is often we are doing according to our convenience. It never like statistics represents facts, just like statistics. So it's always better to use these type of repertories more in our practice, especially when the patient's a common man. They are describing in natural way, natural language. There is no much modification of the symptoms. Definitely that will work. Then you mentioned about the modification of the work by Dr. Sivaraman. There's another one. This is a great legend, no doubt about that. A lot of work in repertory. But you mentioned another point as 5 years took, and it was published before in repertory. Dr. Tanesh, yes, please. Please unmute, Dr. Tanesh.
Thank you, Dr. Manoj, and thank you, Dr. Dhanika. It's really a very good session indeed. There are a few doctors who specialize in this field. Dr. Ajay from Kerala, Dr. Srinivasan from Tamil Nadu. All these doctors are doing excellent work on this nerve repertory, and they are getting great results also. So my question is, what really prompted you to select this nerve repertory as your choice? Because Most people are some using synthesize, some are addicted to KNEER'S repertory, like that.
Yes, sir. See, majority where we are living, and we are living in Gujarat. So what happens? The modern medicine trend has been much more over there, and people don't open up with their personal mentors and all that. So in that cases, when they come usually with the pathological symptoms only and no other symptoms. So during that time, it's difficult for us to use canned repertory, and that's why this repertory is very useful in such cases. Another thing is, I have seen number of the cases where I block. At that time, I'll go with the basic books. That is because the symptoms are here in this repertory. They are from herring guiding symptoms. So that is the basic books, and that's why we get some or the other solution for the particular symptom.
Okay, thank you. Now it's Ram Pravesh sir. Sir, please express sort of thanks to our honorable guest, sir, please. Yes, sir. Please unmute, sir. Please unmute. Yeah.
Thank you, Dr. Manoj ji. Everyone, namaskar and congratulations, Dr. DHWANIKA. Very good case presentation.
Thank you, sir.
According to NEER remedy selection, according to rubric selection, pathological case, breast tumor and facial paralysis, it is. So very, very thanks, Dr. DHWANIKA, behalf of IFPH, whole team. Very, very thanks. Again, presentation. Thank you.
Yes.
Thank you very much, sir. I am being privileged to call here third time.
Okay.
And due to this clinical presentation only, Sani sir especially told me that it will be very
Yes.
helpful to the practitioners.
Yes, the all 11 cases you present, we can see the freedom from prejudice and sound sense that can comment. Let me conclude today's English edition. Hope you back again tomorrow. Till then, goodbye. I know Dr. Shaila to continue the program in Malayalam. Thank you.